And I've also got, should I call him a namesake? Dr. Amaku, but his is Dua, physician specialist and gastroenterologist at the St. Dominic Hospital in Akwetia. Oh boy. I'll take my special song for the afternoon, but not before I suggest to the government that perhaps we need a tax. Yes, a tax on irresponsible fathers. I think we'll make lots of money. Something is burning on my heart today, but hey, I'll find another platform. Check this out. That's right, it's always strong, especially on a Sunday. Take this from Naughty by Nature.
Joy 99.7 FM.
The higher you build your barriers, the taller I become.
Joy 99.7 FM.
The farther you take my rights away, the faster I will run. You can deny me, you can decide to turn your face away. No matter, 'cause there's something inside so strong. I know that I can make it. Though you're doing
Joy
me wrong,
99.7
so wrong.
FM.
You thought that my pride was gone. Oh no, there's something inside so strong. Oh, something inside so strong. The more you refuse to hear my voice, the louder I will sing. You hide behind walls of Jericho. Your lies will come tumbling. Deny my place in time. You
Joy 99.7 FM.
my light will shine so brightly it will blind you, because there's something inside.
That's right, Joy 99.7 FM, Ultimate Health.
I know that I can make
You can tell what the journey is going to be like just from those very early steps. Glad you're enjoying it, but sometimes that something inside could be a viral infection affecting over 300 million people worldwide. 290 million of those don't know. I've got in the studio Dr. Eugene Tete, hematologist, Dr. Amwako Dua, specialist physician and gastroenterologist at the St. Dominic Hospital. We're going back to look at viral hepatitis. I see figures that suggest that the national prevalence should be somewhere in the regions of 12% and above. And we are in a high-risk endemic zone. Remember, Ultimate Health is brought to you by Yumvita, a delicious way to grow. Gentlemen, you're most welcome.
Thank you.
And I know I always choose a track that will move you, eh? Dr. Tete,
Yes.
is this a track you love?
Yeah.
I see. Okay, so even the doctors there,
Yeah.
we don't associate you with music, but I could see that you were moved. Thanks for joining us.
Thank you.
So last week, on the heels of World Hepatitis Day, we set out alongside the theme, finding the missing millions. We wanted to understand why it is that so many people are unaware, oblivious, ignorant of the fact that they may be infected or carrying hepatitis. We tried to explain this viral infection of the liver, but let's just go back and set this discussion. And then there were lots of deep issues that came up. One, how is it diagnosed? Some people say they've been diagnosed. They were positive for the virus, and they were told nothing needed to be done. It'll go by itself. We understood from last week's discussion that a certain higher level of investigation must be done for the clinicians to be able to decide what exactly to do specifically for you as an individual. Doesn't matter what they did for your brother or your sister or your cousin, right? your profile with regard to hepatitis has to be determined, identified, and then decisions will be taken. So, Dr. Tete, let me start with you. Let's just explain again for those who are joining us for the first time what hepatitis is.
So hepatitis is inflammation of the liver.
Okay.
When we say liver is inflamed, that means it's swollen and it's painful.
Okay.
Your liver is the largest organ in your body. It's found midway between your armpit and your hip. So if you don't know where your liver is, just find the distance between your armpit and your hip. Midway there, that's where your liver is.
On the right side.
On the right side, yes.
Right.
And when it is swollen and when it's swollen or it has any problem, you feel pain in that part of the body. And hepatitis can be caused by several things. I think last week we mentioned toxins.
Right.
We mentioned alcohol. Sometimes your body itself can fight itself, so you have what's called autoimmune conditions.
Responses.
But what we are worried about most of the time is chronic viral infection. That's viral hepatitis.
Okay.
And we mentioned that there's hepatitis A, B, C, D, and E.
Okay.
But the ones we are concerned most about is the B and the C, and sometimes the D, because they cause chronic infections.
Okay.
In that they can be in the body, and they will not give you any problems. They will live with you and gradually eat up the body until they destroy a lot of things.
Okay.
Yes, that's the problem.
Those are the ones we're concerned about. Before we move on and get more detailed, when you suggest to my listeners that, well, the other ones are not really that much of a big deal, if you are diagnosed with any of the other variants of hepatitis, right, does that mean that it's not a problem, it's not an illness, it's not, should I say, it doesn't indicate a compromised liver?
It is. What is hepatitis? They need to go deeper. But what we are saying is that those ones can be handled when they are found. If it's alcohol induced, then we know the solution to it.
Okay.
If any drug is causing it, once you withdraw the drug,
okay,
you are sure you'll be okay.
Right.
But these ones live with you for a very long time.
Okay.
Sometimes the whole of your life.
Okay.
And they are with you, and there's nothing you can really do about it.
All right.
Unless you seek proper medical care.
Okay. Dr. Dua, sounds funny saying that, but welcome from Akwetia.
Thank you very much.
And I'm so glad you're in Accra this Sunday and we could grab you. But when we talk of Ghana being in a high-risk zone, right, are there any reasons why in our sub-region or we fall in that zone? Is there anything that makes us more vulnerable or prone to this condition?
Probably what makes us more vulnerable compared to other regions in this world is maybe because of our cultural practices. Okay. Because most of the time, these viruses, the one that causes the chronic infection, are acquired during childhood.
Okay.
More especially hepatitis B. If you have a chronic hepatitis B now, it means that you probably got it when you were 1 year and below.
Okay.
Okay. Because those who get the infection 1 year and below, about 90% of them become chronic.
Right.
And most of the time, the transmission at that time is from mother to child. That means that perinatal.
Right.
If the mother have it and is giving birth, when the placenta is being cut, there is a mixture of blood.
Okay.
So the infection can happen at that time.
Okay.
And then also early horizontal, because there is a lot of things that we do to the babies when they are sent from the hospital home. We do a lot of tribal marks, what you call scarification marks.
Clarification, right.
Okay. And then probably also the way that we handle them. So the transmission also occur at that point. That we call it early horizontal.
Okay.
So from child to child or from adult to child.
Okay.
Okay. Because if you are adult and you get it, it's not a big deal. The body is able to fight it.
Okay.
But at childhood, the immune system have not developed
Right.
yet. So it's unable to fight the infection, and it stays in the body, and you grow with it.
Okay, so in the other parts of the world where these practices are not as prevalent, then that could account for some of the transmission and some of the load in prevalence.
Yeah.
Right. Okay, so you've tiptoed into transmission. Most people want to hear again, well, how do I get this? We've talked about mother-to-child transmission. What are the other modes of transmission for hepatitis?
Okay. So the viral hepatitis is mainly concentrated in the blood, serum, and then if you have a wound, the discharge that comes from the wound.
Okay.
And it's moderately found in saliva, found in semen, and then also the vaginal fluid.
Okay.
They are rarely found in fluids like tears, breast milk, feces, and
Sweat.
then, yes, and
Okay.
then urine.
All right.
Okay.
Let me just moderately found in saliva.
Yes.
Because I've read a lot of accounts which suggest that, well, drinking with somebody or sharing, can you clarify when you say moderately in saliva? And is it something that, okay, if there's saliva sitting there for a couple of minutes, it's still active? Can you explain for my listeners?
Yes, the virus can stay outside the body for about 7 days.
Oh.
Okay. But transmission through saliva is not an effective way of somebody getting hepatitis. That's why most of the time we say that kissing does not cause transmission of hepatitis.
Okay.
Because if you have an intact mucosa, the virus is unable to pass through the mucosa and get to the blood.
So what you're saying is you don't have any oral sores or
Oral
lesions?
sores, yes.
Nothing in your mouth?
Yes.
Right? You would not get that
You will not get
needed or requisite concentration in saliva for it to cause a problem.
Yes.
So why is it that we read sometimes? I was reading something, I think the research was done in the north, and they were suggesting that sharing calabash, drinking with people and so on is a noted mode of transmission. Can you?
So that's
yeah.
a misconception. When it comes to transmission of viral hepatitis,
Right.
especially hepatitis B, there is a lot of misconception
Okay.
about it. So some people think that even sweat, when you get into contact with somebody who have it, you
Right.
can also get the infection.
Okay.
But it does not transmit through sweat and even breast milk. So we do not prevent mothers from breastfeeding their babies if mothers are found to be positive.
Right, okay. 19 minutes past the hour of 2 on Joy 99.7 FM. The program, as always, Sunday afternoon is Ultimate Health, your ultimate guide to healthy living. Brought to you by Yum Vita, a delicious way to grow. You just heard speaking Dr. Amwakudria. He's a physician specialist and a gastroenterologist with the St. Dominic Hospital in Ekwetia. He happens to be in Accra, and of course, on your behalf, we grabbed him. And he's clarifying some of the misconceptions when it comes to the mode of transmission, of hepatitis, viral hepatitis, which is our subject for today, carried over from last week. If you have any questions, concerns, share them with us on my WhatsApp page, 0244340437. And remember, we're also live on YouTube and Facebook, so you can catch us and see what we look like, and more importantly, what we're saying on this platform. Brought to you by Yum Vita. I take a message from them and then come back and deal with some of the other issues.
Yum, 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 Vita. So good for baby, baby. Baby, yum, 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 Vita. So good for baby, baby. For baby. Yum, 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 Vita. Yum, 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 Vita. Oh, Yum Vita. Yum Vita, a delicious way to grow. Yum, yum, yum.
Right, you're welcome back. Yum, yum, yum. That's right. If it's mealtime for baby and you're looking for a healthy, easy-to-digest infant cereal packed with essential vitamins and minerals, an infant cereal that has omega-3 to aid in the healthy development of your child's brain, then definitely, ultimately, you choose Yum, 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 Yum Vita. It comes in 2 delicious flavors, wheat only, and a combination of maize and wheat. It's got it all. Yum Vita, a delicious way to grow, brings you this educative, transformative discussion on hepatitis. Got loads of questions. Nabo Telekwe says, please, my question is, what does the 3-interval injection do? And also, why 3 doses and not once like some other diseases? We'll deal with that in a second. Some of the stuff from last week. Hello, Naughty. I have vaccinated against hepatitis B, and one day I went to the hospital and I was unwell. After I went to the lab, the doctor told me that I had hepatitis B. I was surprised. The doctor reordered the test again the second time. They said I did not have the disease. How can this happen? And if I've vaccinated, is it possible to give my wife the antigens? This was from Jojo in Pantang last week. Again, somebody wanted to know what it meant to be diagnosed with inactive chronic hepatitis B. What does it mean? So we're looking for meaning, not just the descriptions. Note kindly asked the doctors if it's possible not to build any form of immunity after the vaccinations. I took all the 3 shots 5 years ago, but after testing, it shows both the antigen and antibodies negative. It remains same after I'd taken the booster. A doctor told me some people never build immunity no matter the vaccine one takes. My husband is Hep B positive. What can I do? I feel so exposed. This was Ama in Osu. So we answered some of these last week, but we'll come back now that we're going deeper into the topic. Remember, if you have a question or concern, WhatsApp is 0244 340-437. Ultimate Health, brought to you by Yum Vita. Doc, so transmission. So some of these things are putting out wrong information, suggesting that, well, if you sit next to somebody in a trotro and they sweat, or if you share a drinking utensil or something with somebody, you're saying that this is not a significant, worrisome mode of transmission.
Yes, that's so.
Okay. Right, you heard it on Joy. So, blood transfusion, right? Yes. I heard you mention that as a possible mode of transmission. Yeah. Now, I know when we do these mass screenings and blood donation campaigns, some people, unfortunately, during those screenings get to know that they are positive for hepatitis. But when you say somebody can get it through blood transfusion, it seems to suggest that no further workup on the blood stocks is done. Correct me. Is that the case?
So we have
hematologists. I'll take that.
Right, the hematologist.
So, so what happens, as you said, rightly, when anybody who donates blood, the blood is tested for not just B and C, HIV 1 and 2, syphilis.
All right.
So we check for all these things, about 5 different diseases that we and if the blood is found to have any of these infections I've mentioned,
right,
it is not used.
It is discarded.
It's discarded.
Okay.
But we just don't discard it. Where you realize that we take the contacts of people who donate.
Right. So you do tracing.
So there's a follow-up, and most people don't come back when we call them. But when you do, we have doctors who will take you through the process, counseling, and we refer you appropriately to Dr. Julia's clinic, where they will take over from that.
Right.
So, but sometimes when you receive blood from, I would say, unapproved sources, people are taking blood from all sorts of places. People are doing all sorts of things with blood. Then you are not assured of the test and the test results. But if you take blood from a hospital that is well established, recognized hospital, I can assure you that blood that is negative is positive for hepatitis B and C will not be given to you.
Okay.
But people are taking blood from all sorts of places, and that's where the risk is.
All right, that's curious, and I know I've taken this up with the National Blood Service, and that's the reason why we want the new, the bill passed, so that we can have the structure of the National Blood Service, so that we know where blood is collected and the kind of processes it's gone through. Okay, right. Dede is back, Maryland. Dede in Maryland says, my question last week was not answered, and it's below. Is it due to the mutations and that the prevention and precautions vaccination does not work, just as the flu vaccine here? If the shots don't work, and I don't think we've said that, right? If the vaccination, that's what she's implying, doesn't work, why are we constantly bombarded to take them? Or is it a placebo? They wants to know. Now, we know that if you have been exposed, then you are not a candidate for vaccination. Oh?
Yes.
Once you have the virus,
right,
you are not a candidate.
So when we are vaccinating, essentially we're dealing with people or populations that have not been exposed, and therefore we seek to protect them.
Yes.
Okay.
Those who have tested negative to the surface antigen.
Right.
Yes. That's
okay.
what we do.
So can we answer Dede's question in that context?
You see, when it comes to vaccination,
yeah,
yes, about 10 to 15% of those that receive 3 doses of vaccine do not respond to the vaccination in the first attempt. Okay. And these are people that normally are immunocompromised. So if you have people that have cancer, those that are on chemotherapy.
So for other reasons, their immune system is not functioning at the optimal level.
Yes.
So there's already a problem.
Yes.
Not specifically due to hepatitis.
Not due to the hepatitis, and also not due to the vaccines that we give to them.
Okay.
Okay. But those that do not respond, they need to receive the second 3 doses.
Okay.
And almost all of them are able to respond when the second 3 doses are given to them.
Okay. So what you're saying is that a vaccine really triggers the response.
Yes.
And helps your system build a defense.
Antibodies, yes.
Right. Okay. Now, for persons whose immune system already is not functioning the way it should, it's likely that you will get the response the day is talking about, where
Yes.
the vaccine, so to speak, did not work.
Yes.
So you need a further three shots
Three
of
shots,
that.
yeah.
So would that be explained typically to the person? Would they be told? Because it sounds a bit counterproductive for people to hear that a vaccine did not work.
Yeah, the issue here is, you see, most of the times we don't check post-vaccination. We don't check whether the person have built antibodies or not. We assume that once you have received the 3 doses, you are okay.
Doc, when you say we don't check, who doesn't check? Who is supposed to check? What is the protocol? All right, there's a condition, we know it's a worldwide public health concern. Now, thankfully, we've developed a vaccine for it. Okay, so those who have not been exposed can be vaccinated, and the expectation in terms of outcome or yield is that they will build an adequate resistance to the condition. Okay, now you're saying in some instances, we give the vaccine, all right. We're quite happy saying it's here, it costs this much, come and take 3 jabs at these intervals. But we fail to follow up on the envisaged response. So who is supposed to program that response? If I go to a vaccination facility and I get the shots for hepatitis, am I wrong in assuming that I'm protected? Because this hypothesis or explanation we've given suggests that in some cases, we won't get the outcome. So wouldn't a follow-up be built into the protocol? Or isn't it built into the protocol?
You see, ideally, as part of the recommendation, it is not recommended after receiving the 3 doses
Okay.
to go back and check whether you have developed antibodies or not.
Okay.
It's for those who are at high risk group that those people will recommend that they need to check whether they have built antibodies or not.
If you fall into the high-risk
Group.
category.
Yes.
Okay. So can you just hit on those again?
So the high risks are those who work in the health workers, okay, the prisoners, men who have sex with men,
Okay.
and then the commercial sex workers.
Okay.
Okay, most of the time the prisoners.
You're not worried about women who have sex with women?
No, that one we are not.
Really? Okay, it's the doctors who said it. I didn't say it. But if you just joined us, it's 29 minutes past the hour of 2 on Joy 99.7 FM. You're listening to the one and only Ultimate Health on Joy 99.7 FM, brought to you by Yumvita, a delicious way to grow. You've just been listening to Dr. Amwakudria. He's a gastroenterologist and a physician specialist. A lot of lists, right? But he works at the St. Dominic's Hospital in Akwatia. He's with you. And also, Dr. Eugene Tete is a hematologist at the Kolebu Teaching Hospital. Doc, let me just hit that for my listeners. We have discerning listeners. But when we say a gastroenterologist, right, lock it down for us. What do you do?
So we take care of any disease that affect the gastrointestinal tract.
Okay.
Let me say from the mouth to the anus. We take care of disease that affect the liver, the
Right.
pancreas.
Okay.
So anything that is in the abdomen, we take
All
care
that
of.
is your territory.
Yes.
Okay. So if it goes below that, then you have the other plumbers,
Yes.
right? Like the gynecologist and the urologist.
The
Okay.
urologist,
All right.
yeah.
So today, you know what a gastroenterologist is. Huh? I know many of you are waiting for my tongue to trip on that, and then you will be texting me. Huh? But let's move on. Okay. So diagnosis, right? A lot of people sent us things last week. I was told I had inactive yet chronic Hep B. I was told this, but later tests were contrary to this determination. Is there a problem, or are we not following the right protocols when it comes to diagnosis or testing for hepatitis?
When it comes to diagnosis, we have stages. Okay, so we have a screening test,
Okay.
and most of the time the screening test, you may have about 10% giving you either false positive or false negative report. False positive means that you do not have the infection,
But it says you have it.
but the test will tell you have
So,
it.
Doc, the 10% false positive, is it, should I say, an expected error margin? It sounds pretty high to me.
Yes, it sounds high.
Right.
It sounds high. But when it comes to the screening test for hepatitis B, that's the...
So screening means you've got a large pool of people and you are testing them for what? Surface indications.
Yes.
Right.
Surface
So you would
antigen,
get about a 10% margin of error, false positive.
Yes.
Can you explain the false negative
So
again?
false negative means that you have the infection, but the test will tell you you
It
don't
passed
have.
you and said you're cool.
Yes.
Right. Which is
So-
a way bus. But by that one, I will not even come and ask you questions.
Yes,
Right.
that's
And that is also a 10% margin?
Yes, it's closely around that percentage. Yeah.
Okay. So having said that, and we use these tests to start the process. So you would start initially for the average person from a screening test.
Yes.
Okay. And these are the margins of error, which suggests to me then that everybody who tests for hepatitis should be going further. Or am I wrong in saying that? If this is the margin of error, okay, if I remember all my statistics and all my stuff, that's quite a...
Yes, it's quite high, but we do not tell people that are negative or positive to go further and do other tests.
Okay.
Like if you come and you test negative, unless based on your clinical history and examination,
Right.
we still suspect that it's hepatitis that probably may be causing your condition.
Okay.
That one we will go ahead and do further testing.
Okay.
But if we just go out and we are screening people and you come and you test negative,
Right.
we see you as somebody who doesn't have the infection.
Doc, if I was a collating or collation officer at an electoral station, I'll ask you for recount. Say that again. I've tested, you say there's this margin of error, but you would not normally or typically, in mandatory fashion, request that I go further. Wouldn't that account for the missing millions we're now looking for under a theme? Wouldn't we have got a lot of the missing millions if we had that level? Even if it cost the person a little more money, wouldn't it make clinical sense? Or it's too much of a, how should I say it, a bother?
See, looking at the percentage, yes, 90% the screening test will tell us the true results of
It's
the
pretty
person.
accurate.
Okay.
Let's
And
concede
then the
that.
10%, it will not tell us. So does it mean that based on this, we should subject the other possibly 90% that the test results is true into a further test?
That's the question I'm asking you.
That's the question.
You're just
That's
you're repeating my question.
It will not be worth it.
It's not worth it.
You are getting
clinically.
90% where the test is accurately telling you that they have it.
Well, from what my
You
list,
have under 10%
Yeah.
where it is either giving you a false negative or a false positive. So statistically, I think that it is, for us, 90%
is good,
is good enough.
but your theme doesn't suggest that.
Yes, so that's why once you test negative, we don't tell you go and don't. You can be tested at another time.
Okay.
Yes, and even when you test negative, we tell you that they need to go vaccinate, go to a place of vaccination.
Okay.
And when you go to a vaccination center, most at times, depending on the time period that has elapsed
Okay.
from the time you tested, they will retest and confirm whatever they are.
Okay. 35 minutes past the hour of 2 on Joy 99.7 FM. My name is Norte by nature, or call me Norte Dua. I'm in the studio with Dr. Eugene Tete, a hematologist, and next to him, Dr. Amakudria is a physician specialist and a gastroenterologist, right? Anything between your where and where. It's his business, all right? Dominic Kabute Sr. says, I would like to know if chronic hepatitis B can leave the body after several treatments. Leave the body. I like the way you put it. Perhaps he's suggesting or asking about cure, right? Dominic Kabute Sr., thanks for sharing that, Doc.
Yes, even sometimes without treatment. So every year, we estimate that about 1% of people that have chronic Hep B are going to lose the surface antigen.
Okay.
That means that when you test them, they will come out to be negative.
Okay.
And they will build an antibodies against further infection.
Okay.
So yes, it is true, whether you are on treatment or you are not on treatment, you can lose the surface antigen.
It's true.
But it's a minority of
About
people.
1%.
Yes, about roughly 1%.
So if I, so to speak, I have that seroconversion in terms that my blood no longer shows this antigen, right? Is there any need to follow up on this conversion, or it's assumed to be, in quotes, a cure? Would I need to come back for further tests to ascertain whether that reversal of my serostatus is maintained?
You don't really do a further test. But I see when it comes to hepatitis B, they are quite a tricky virus. Okay, we may tell you that yes, the surface antigen is no more, so you don't need any follow-up or any checkup.
Okay.
But let's say if you develop cancer of the blood, let's say leukemia or lymphoma, and you are going to receive a chemotherapy, though you have lost the surface antigen, but once your immune system goes down, the virus can start replicating again.
Okay. All right. So you need to be talking very seriously with your doctor about this thing. It's not just a matter of taking shots or following treatment regimes. It sounds very complicated, and I'm glad we're doing this second take at it. I've got this from Sister Amma. She says, my mom tested negative and went for vaccination. She became so weak to the extent that she couldn't do anything for a week. It's making me afraid of going to be vaccinated too. Right. Are there any known, should I say, adverse effects of the vaccine?
Yes, there is a side effect of any drug that you take, and then also vaccines that you take. But hepatitis B vaccine is one of the safest vaccines that is available in this world.
Okay.
And that's why you can give to everybody, whether they are pregnant, whether lactating mothers, babies, and everybody can receive. So yes, one or two people may get this reaction, but it's a safe.
Let me also add that sometimes the weakness might not be due to the vaccine.
Okay.
What could be happening at that time? Maybe the mother herself had some problem going on. But once there's an intervention, then they attribute it to the intervention. But I don't know. Maybe we have to find out some more details.
Okay.
But it could be something else and not the vaccine.
Right. So if you're sending us these things, they give us insufficient information to make conclusive judgments or give you conclusive advice from what we see in WhatsApp. That brings me to my question, which I hit last week, which is, should I be seeing a specialist? Should I just walk, do some tests, and then respond to what the tests say? Or do I need to now draw closer to a gastroenterologist or whatnot? I mean, who should I be dealing with when it is hepatitis?
So when it is hepatitis, I think any doctor has been trained how to evaluate anybody who have hepatitis B. Okay. But so if the doctor evaluates and thinks that it's above him or her, then refer to the specialist who deals
Which
with
doctor
that.
will look you in the eye and say, this is above me? I'm looking at a situation where the communication is not as it should be. Can I, the patient or the client, now push for further evaluation or another opinion of my situation with regard to hepatitis?
Yes, in the medical field, that's what we encourage the patients to do.
Okay.
If you think you are not satisfied with the service you are receiving from one particular doctor,
you can.
You move ahead and seek.
All right. Okay, I'll take another, message from my sponsors, and then when I come back, we'll look at some of these issues of treatment and how these decisions are made. Some people shared with us last week that they've been told they don't need any treatment. They should chill, so to speak. Others too are following treatment, and tests are telling them that nothing has happened. Pretty confusing, but here we have knowledge over noise. It's called Ultimate Health, your ultimate guide to healthy living. Tell somebody next to you and stick and stay. I'll be back.
Yum, 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 pizza. So good for baby, baby. Yum, 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 pizza. So good for baby, baby. Mm-hmm. Yum, 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 pizza. Yum, 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 pizza. Oh, yum, pizza. Yum Vita, a delicious way to grow.
Yum, yum, yum. Oh, I love that. Yes. If you're looking for a healthy, easy to digest infant cereal packed with essential vitamins and minerals, also has omega-3 to aid in the healthy development of your child's brain, then you're talking yum, yum, Yum Vita. Comes in 2 delicious flavors, wheat only and a combination of maize and wheat. It's got it all. Yum Vita, a delicious way to grow. And it's somewhere in the chorus there, they say, so good for baby, so good for baby. But I see the guy eating the baby's food in the advert. Yum Vita. They bring you ultimate health. My phone lines are active, 0302-216-541, 0302-216-541. You can ask the questions yourself. So we need to understand now, well, how are these decisions made? Who needs to be treated? Whose liver functioning is so compromised that they need to see a specialist, and so on and so forth? Let me start with the territory manager, the gastroenterologist, Dr. Amakudia. I mean, so how are these decisions made? I've tested positive. What else do you need to know, and what will you be telling me?
So there was a question that you read earlier.
Yeah.
That somebody have been told that he has a
Chronic inactive. Yeah.
hepatitis B virus. Okay. So all those who have hepatitis B, it's only about 40% that are going to require treatment in their lifetime. And this 40%, we call them, they have active viral hepatitis. And we treat patients who have active viral hepatitis. Those who have inactive viral hepatitis, we don't give them any treatment.
Okay.
But
Let me just,
we monitor them.
You monitor them.
Yes.
So inactive, that borderline
So
between active and inactive, is it based on the viral load? What is it? How is it determined?
So mainly it's based on the viral load.
How many copies
If
of the
the
virus?
viral load is less than, so we have 2 types of the virus.
Okay.
So we have E antigen positive
Mhm.
and then E antigen negative.
Mm-hmm.
So if you are E antigen negative,
Mm-hmm.
it means that if your viral load is less than 2,000 international units per mil,
Okay.
you are considered to be inactive.
So essentially, the clinician has these cutoffs
Yes.
based on the type of virus
The
you have,
virus that you
and
have.
they will put you in the right category.
Yes.
All right. I have Ajiman on the line from Tema. Let me just take him. When I come back, I'll be asking you whether these cutoffs and this information or decision can be arrived at from the first screening test, or you would have done something higher than that before you get to that decision. Ajiman, good afternoon.
Yeah, afternoon, Chief.
Right. You're most welcome. You're in Tema.
Yeah, we thank God that you continue this program so that we get to the end.
Well, we respond to you all the time.
Yes.
Go ahead.
In the doctor's submission, he was saying something that the hepatitis, some are by birth. If it is by birth, then it is it's something that cannot go completely, or chronic one. I want to find out which of them, because we have A, B, C, and D. A friend of mine is suffering from the B, but when he started doing exercises, checking his diet, the symptoms were not being shown. If it happens like that, is it infectious, or if it is chronic, is it going to be with you so you die if you manage it?
Now, Ajiman, your friend, did you say B or D?
B.
D.
B.
D for dog.
No, B for ball.
B for both road. Okay, got it.
Yes, sir.
Okay, right. So, docs, he wanted some clarity on what you said when you said, well, for most people who develop to chronic stages, they tend to have gotten it before 1 year of age, right? He wanted some clarity on that, and then whether that is something that is going to stay permanent or stable over life.
Yes. So, you see, we even if we are treating, we say that we do not cure hepatitis B.
Okay.
But we treat hepatitis
You treat
B.
it?
Yes.
Okay.
So if you have the chronic infection,
right,
unless like the 1% that I talk about,
right,
you lose it naturally by yourself, then that one we can consider you to be cured.
Okay.
Okay. But when the surface antigen has not left the body,
right,
it means that it's chronic and it's continue to be with you.
Right.
So when you have it, it's very difficult to get it out of the body.
Okay. So from what he's sharing, his friend said, well, he's been eating well, or there's some dietary restriction, right? He's undertaken. Symptoms have subsided, if not remitted. when you are not having the telltale symptoms we talked about, fatigue, darkened urine, jaundice, or the yellowing of skin and eyes, and so on and so forth, is it safe to assume that, well, I am okay from what you're saying?
These symptoms normally happens in those that develop the acute.
Okay.
Okay, the adult that get the acute infection,
Okay.
they normally develop these symptoms.
Mm-hmm.
And if you are adult and you get the infection, about 95%, the body will clear it.
Okay.
That one it will not become chronic.
Right.
But those who have the chronic infection, most of them are asymptomatic.
Okay.
They don't have symptoms
It
at
makes sense to me, but again, when I put it against the theme of locating the missing millions, it sounds to be a disincentive in the sense that people will tell themselves, well, they say 90% of us will sort it out anyway. So maybe I'll play the game by thinking I'm one of the 90, and therefore I will not actively, respond to the message to go and test. How would you...
Because if you get an acute infection,
Yeah.
you can develop what you call fulminant hepatitis.
Ouch. What's that?
The fulminant hepatitis means that, let's say you have gotten liver failure. And those who develop the liver failure most of the times succumb to the infection.
Okay.
Okay, so that's why it is good and safe for you to get the vaccination even if you are an adult.
Okay.
So that you don't get
All
into
right.
contact.
Okay, so don't get any of the responses twisted. They are specific contextual responses to specific questions people have asked. Very often, people tune in at a certain point and they say, they said this. Okay, I've got Sharif God MC. Right. Wow. Sharif God MC, he asks, if someone has ever been diagnosed with the virus and later tested negative, can the person take the 3 doses? So at some point in time, you got a positive test result and later you got a negative, which puts you in the pool of candidates for vaccination. Should you still go ahead?
No, those people don't need to go ahead for it.
What they would not go for the vaccine, what should they do?
Because that means they've developed the antibodies.
Okay.
So they already naturally, because they've been exposed to the virus already, and their bodies have mounted immune responses.
Okay.
The right immune response.
Right.
And the body has, to for lack of a better statement,
Cleared it.
Cleared of it.
All right.
Cleared it. So now they are immune naturally.
They are immune. Are they carriers? Are they? Is it possible for them to transmit or infect somebody else?
No.
No.
For them, no, they
No.
will not, because they have their bodies have sort of helped them out.
Okay.
Yes. So they don't need to be artificially vaccinated.
All right. Kabute Senior comes back and wants to know the food hepatitis B patient is supposed to eat or avoid. It always comes up. Docs?
That's also another misconception.
Right. Okay. We'll come to that in a second. You see, when you come on Ultimate Health, bring all your notebooks. Right. And the doctors love this show for specifically that. Good afternoon, Norte. Please, can chronic Hep B cause bad breath or body odor? Odor. Right. And is there a cure for that? Which one? The Hep B or the odor? Or both? This is from Daniel Brooks. Oh, Daniel, he was on with us last week, where he sent a couple of issues as well. So, which do we deal with first, the food or the body odor?
So this one, it doesn't. The
It doesn't?
odor, Hep B doesn't cause.
And neither does it cause the
Bad breath.
breath.
Yes.
Okay, halitosis.
symptoms.
Okay, right. So, is there any specific food you should eat or avoid?
The only thing that they should avoid is alcohol and sometimes some herbal medications. Okay. Apart from that, they can eat any food that they want to eat. Because at the end of the day, you see, the virus is against the immune system. The virus is fighting against the immune system. If the immune system is able to overcome the virus, the body wins.
Okay.
But if the virus overcomes the immune system, the virus wins.
So it's not
you
dependent
need
on
to
your diet.
eat a balanced
diet. Okay.
So you can eat any food. Sometimes people say don't eat oil, don't eat meat, don't eat it, don't eat this. It's all not true.
Okay.
Yeah.
He's the man in charge of eating and how it's processed, and he's a gastroenterologist. So when he says it, listen to him. I have this sharp pain under my ribs on the right side. I went to do a scan and it confirmed nothing was wrong, but the pain has been there for years. I don't know what's causing my pain now. Sister Amma, right, she's the one who's also afraid of being vaccinated because her mom had a bad or painful, unpleasant reaction. Huh?
Yes. I'll just say that there are other structures on the right side of the body where the liver is. The gallbladder is closely related. The kidneys at the back. So any pain there needs to be evaluated properly. it might not-
Wouldn't any of those have been detected by the scan? She suggests.
sometimes some of these, if it's gallstones,
Right.
scans, ordinary scans that we do,
Okay.
sometimes might not pick it up.
Okay.
But you need to do evaluation first.
Okay.
See a doctor, and then if there need be, we'll do other tests. That will
Okay.
pick it up.
I'll go further. Any doctor?
I would say that for a well-trained doctor who knows what he's doing,
What he's doing.
should be able to pick some of this stuff. If he is not able to, he will let you go higher and see the appropriate
Okay.
people, yes.
I don't want to ask what a well-trained doctor looks like. I've got Jacob on my line from Kaswa. He's been waiting for a while. Good afternoon, Jacob.
Good afternoon, Note.
Thanks so much for waiting. Share with us.
Great. Basically, I would like to find out from a guest in the studio. Have they come across noni juice, N-O-N-I? It's a positive impact on hepatitis B.
Hey, Jacob and your noni juice.
Through their readings, they've come across it.
Jacob and your noni juice.
Yes.
I've told you time and time again, nobody challenges noni juice, but it is not a conventional treatment. You bring it up each time, right? It does certain things, and I'm willing to do a program, but you apply it to every program we do, right? So I don't think it's in contention at all. Docs, do you have anything to say to that?
No, non-juice is not recommended for treating Hep B.
Right.
I mean, you may take it, you have some multivitamin, that thing that can boost your immune system, but it's not.
All right. Jacob, are we cool on that?
Yeah.
Okay.
My point is, research has proven that noni juice is very positive.
It is not a cure. And there are bases and paradigms for determining something to be curative. And it goes through several years, okay? Some things are supplements, or they can facilitate or enhance immune system generally. But to specifically tie it to conditions, I've told you several times. We've had this discussion before, haven't we?
Yeah.
Okay, so when you say research, if you bring me the research pound for pound, we can do it on Ultimate Health, okay?
Okay.
No
Then
problem.
I'll do it.
No problem.
Thank you.
Right. That's Jacob in Kaswa. He always brings it up, and I know he produces noni. And I remember when I did HIV training in Uganda, noni and moringa and all those things came up. But you'll find in the protocols, they don't even come that close. Yes, I have another caller on the line. Hello.
Yes, sir.
Good afternoon, sir.
Yeah, please, this is Hajima Joseph. I'm back.
Right. The way you call me, sir, I stood up. I got off my seat.
Yeah, I'm enjoying the conversation very well, but
Great.
I just need a very clarification on some certain things.
Go ahead.
Talking about hepatitis B, if it is chronic and it can be managed, and let's say you have an intercourse with the partner, is the partner going to get it? That's one. And the man is talking about improvement of immune system.
Right.
So I was thinking that there's a certain diet you should refrain from it, so that your immune system.
He has
stay
corrected
strong.
that thinking. He has corrected that thinking, okay? So if you were thinking that way, I think Doc has conclusively corrected that.
So you don't think much about what to consume.
No, he said you should eat a balanced diet.
Okay.
Okay.
So once you are managing it, and let's say it is chronic, it might not completely go out of your system. You're managing it. What about you having a partner? Is the partner going to get it?
Okay. That question, as the electoral commissioner, I will admit. Right? Doc, can we quickly hit on that? He's saying that he's chronic, he's managing it or adhering to treatment. Should there be any precautions you should take with regard to sexual intimacy?
Most of the time, it depends the number of virus in the blood.
Your viral load.
And then, you see, sexual transmission, yes, it does happen, but it's not an effective way of transmitting it.
Okay.
Okay.
All right.
So when you are on treatment or we tell you that it's inactive, it means that you are unlikely to transmit.
Okay, Note, please ask the GI expert what could cause bad breath and body odor. Back again on that. We've done lots of programs on halitosis. You want to see the relationship when it comes to gastro issues and intestinal issues. Or we should say that's another program.
Yes, I think it's mainly the ENT people.
Right. I'll take your number. Since you've asked several times, I'll put you in touch with the ENT and the dental specialists, okay? So I'll take your number down and get you back on that. Alcohol in moderation or abstinence totally. If abstinence, why have we been told a glass of red wine, no matter. A day is good for the prevention of Alzheimer's. Wow, we got to Alzheimer's here.
So I mean, so alcohol. Once you have hepatitis, that's another. Alcohol will come in. It's like two people fighting one person.
Right. It doesn't make matters
with time,
any better.
With time, they overcome. No matter how strong the person is. Yeah. So I think the teaching is that once you have hepatitis, you have to stay away from all other things that can affect the liver.
Yes.
And that's
one of them is alcohol.
Yes. So if you don't have hepatitis, then you can take your glass of wine a day.
Okay.
If that's what the doctors tell you. To do that, yes.
Right.
But once you have hepatitis, then we say that herbal, as Dr. Bia mentioned, herbal medications, alcohol, or sometimes even some of the drugs that we take, we tell you that don't take them.
Don't take them. Okay, doctor's advice. And sometimes we like to rationalize. The psychologist will say you are in denial or you're rationalizing, so that when you make it a glass of wine, it sounds a bit polished and less harmful than maybe a tot of apio. Alcohol is alcohol, and the doctors have said it just the way they should say it. But last week we had John Aniglo called about his test. I think I've given you his number.
Yes.
Have you spoken to him yet?
No,
not yet. Okay.
But I'll call him and we'll follow it up.
Right. John, we wanted to take you through the system to see what went wrong and why your tests seem to be dancing all over the place, if that is indeed the case. So between Dr. Zamu and Dr. Tete, we'll go through that with you and see if we can use that as a test case to talk about some of these things. So wrapping up, I see my senior waiting in the wings to play music. What are the key things? And again, we mentioned the clinic. Can you give the days for clinic, especially in Kolebu?
Yeah, so Kolebu, the gastroenterology clinic is on Tuesdays, but it's a booking clinic.
Right, by referral.
We recommend that you come in with a referral.
Okay.
And then you get booked. We are careful not to say that everybody should come to Kolebu.
That's right.
Because the numbers are quite huge. Hepatitis is, as we said, we are in a high prevalent country. So if Kolebu cannot take everybody, that's why I said, see your primary care physician.
See your doctor first.
Go through your processes, and if there need be, we give you a referral to Kolebu. You come and book, and you'll be seen.
And the clinic is Tuesdays. I've got Joe in North Carnation. Let me quickly squeeze him in. Joe, good afternoon.
Afternoon.
Right, fire.
I'm well advanced in age, and last time I heard you say something like one of the hepatitis affects the stomach or something. My stomach is getting big. Is there any connection with hepatitis?
Wow. Okay. For a last call, you give us very little to go on, but his stomach is getting big. We talked about the right side of the stomach and other things. I say it should be verified clinically, right? Whatever is causing the...
I think the only complication of hepatitis B that can make your stomach big is when you call it ascites. Okay, when the liver is not working the way it's supposed to work, and then you see a lot of fluid in the tummy, and then it will make it big.
Okay, so go to the clinic, check, and we've learned that some of these test results should just not be taken anyhow, and we need to follow up. Sometimes that follow-up is actually initiated or requested by the doctor himself, but the doctors in my studio, Dr. Tete and Dr. Amakudria, have said, look, nothing prevents you from seeking a second opinion. So if you still feel uncomfortable with the procedure or the processes, please follow up and get another expert opinion. Dr. Marco, you're in Akwetia, so I'll give you the parting words.
Okay. So hepatitis B is endemic in this country. And looking at the havoc that is causing in the health system is the commonest cause of liver failure in this country.
Okay.
And about 80 to 90% of all those who have cancer of the liver in this country is as a result of hepatitis B. Okay. Cancer of the liver is the commonest cause of cancer death in this country. Though people talk about prostate,
so all the other prostate,
cervical,
cancer of the liver tops the league table.
Yes, it's cancer of the liver. And if it is hepatitis B that is causing it, it means that we can prevent death from people
by knowing your status with regard to hepatitis. Great.
And if you need treatment, we put you on.
All right, great stuff. We wrap up on Ultimate Health, Joy 99.7 FM. Bilay is up with Sunday Rhythms, and I know when he's setting his stuff up, he's got stuff. Even when he's in short sleeves, he's got stuff off his sleeves. Sunday Rhythms comes next. My name is Note by Nature. I've been speaking with Doctors Tete and Amakudria on hepatitis. We did a second take because we didn't quite finish it. But that league table is scary. Liver cancer. fueled strongly by hepatitis, tops the table. Believe me, Ultimate Health will come back to that. Abeku Sankofi, my producer, many thanks. And of course to you, my discerning listeners, for sticking on Joy 99.7 FM. Don't go nowhere. Belay is here.
The taller I become,
Joy 99.7 FM.
the farther you take my rights away, the faster I will run. You can deny me, you can decide to turn your face